pictures you just saw are only some of the symptoms of a disease called scleroderma. They always say if it bleeds, it leads, so we wanted to shock you, to get your attention, so you might learn about scleroderma. Scleroderma literally means hardening of the skin, yet you also find a myriad of other symptoms that people have that are either external, internal, or sometimes both. What we showed you was a minute fraction of what people can and do suffer with daily because of scleroderma. This disease can lay dormant for years in your body. A dear friend of mine who has scleroderma did not have skin involvement for 10 years and therefore was not diagnosed with scleroderma or treated for it. She was treated for the symptoms. Actually, getting a diagnosis is easier for someone who presents with what they call the hallmark, the skin involvement. There is systemic and limited scleroderma and both have subsets. There is no known medication or medication cocktail that will cure scleroderma. They're all in the experimental phase. 4 times more women than men have scleroderma, but it is a disease that does not discriminate. The very young to the very elderly can have scleroderma, although the age range that is most affected is women 30 to 50 years of age.
Scleroderma is a disease that needs a cure. Currently, there is not a cure for the disease. However, in order to find a cure, people have to advocate in different ways. On May 14, 2009, state representatives introduced a bill called the Scleroderma Research and Awareness Act to the House of Representatives. In doing so, they hope to give the estimated 300,000 Americans and their families living with the disease the hope to continue research and such until there is a cure found. In having the bill passed, it would hopefully educate individuals and establishments such as the Center for Disease Control and Prevention about the disease, and to get others involved by way of a public campaign, for example. Research is incredible, and stars such as Bob Saget and Robin Williams, who have been directly affected by the disease because of loved ones who have passed away, are now advocating stronger than ever for there to be a cure. They, along with others, need everyone else's help to advocate to find a cure for this horrible disease. There are all sorts of ways to get involved. Every year there is a national conference, Facebook groups, foundations, and walks that you can raise money for.
Scleroderma is a thickening of the skin from the overproduction of collagen in the system that can affect the blood vessels, as well as changes in the immune system from inflammation. Widespread skin involvement more often results in severe internal organ damage than in patients with less skin involvement. By the time the skin of the arms is tight, there may be stiffness in the legs, thighs, and some of the chest and abdomen area. The skin tightness usually appears on both sides of the body. Many people live with scleroderma dormant in their body for years before the onset of symptoms. No one knows why it presents at any certain time. Women are 4 times more likely than men to be afflicted with scleroderma. No identifiable genetic component has been directly linked as of yet. It can affect anyone at any time in their life, but the age ranges from 30 to 50 years of age. It is important to write down a list of the symptoms a person has for the initial examination with a pulmonologist or rheumatologist, to avoid lengthy and expensive doctor visits which insurance may not cover. Bring all test results and x-rays to make sure all of the records from previous doctor visits are at each current doctor visit. Be sure and keep all of your records. Education and research are vital in diagnosing and treating this disease.
Here's what we want you to think about. Just imagine being given this diagnosis. If someone were to say to you that what you saw in those pictures at the beginning is probably going to happen to you, that you might have to be on oxygen for the rest of your life, and how all of these things might affect how you feel about yourself. Like we said, this disease does not discriminate against anyone, but women are 4 times more likely to get it, yet men suffer too. Get on the net, read about this disease. It can affect so many different areas externally and systems internally. But read, find out about it. Please, watch the movie for hope. These are real people who have scleroderma.